The Affordable Care Act by Sophie Trivino-Perez. The American healthcare system has become more accessible through the Affordable Care Act of 2009 by President Obama, reducing racial, gender, and ethnic disparities. However, our government stays under a constant dichotomy of collectivity versus individuality within the healthcare access. When compared to other international systems, such as France, we can see that it is possible to have universal healthcare accessible for all. There will be four parts: healthcare versus public health in the US, political impacts, racial and ethnic impacts, and the US versus the French system. So, what is the ACA? What do we know? It provides federal subsidies for individuals and families to access individual private health insurance. The positive impact of the ACA is a swift access to services, decrease of Medicaid spending budget, and reduced hospital acquired conditions and better population government relationships. So let's compare the public health system with the American healthcare system. Let's look at the American healthcare system first. There's two different approaches to organize it: the Dawson model, or regionalized healthcare, and a freer flowing one. The Dawson model is regionalized, which means that different types of personnel and facilities are assigned to distinct tiers in the primary, secondary, and tertiary. This is more representative of the UK model. In the US, patients have traditionally been able to refer themselves and enter the system directly at any level. The resulting structure resembles a diamond more than a pyramid, with a small number of hospitals, mostly rural, that lack specialized units at the base, a small number of elite university medical centers providing highly super specialized referral services at the apex, and the bulk of hospitals providing a wide range of secondary and tertiary services in the middle. Now let's take a look at the public health system. The public health system promotes and protects the health of people and the communities where they live, learn, work, and play. For example, women health. The ACA provides access to highly effective, long-active, reversible contraceptions, especially for teenage girls. Through public health, we act upon prevention. What are the challenges of the ACA? We can't forget that the ACA was a turning point. Even though red states have never been in favor of the ACA fully, both parties came together and allowed the ACA to become a turning point in the healthcare system. Political challenges. First, the Republican Party. They opposed the mandate that all Americans must have health insurance, the individual mandate, and they oppose a government role in healthcare. About half the country does not trust the government. Helped with the overwhelming negative ads, we can understand why they oppose a government control healthcare in the first place, especially since most of the knowledge opposition has on ACA has been acquired by TV. Republicans have always been threatening to repeal Obamacare, and in 2016, they also influenced the votes of the population. The Democratic Party. In March 2010, when Obama signed the Affordable Care Act, he made quality, affordable health care available to all Americans, and 20 million Americans gained health care coverage. Democrats fight all attempts and fought all attempts by the Trump administration to repeal the law and take healthcare away from tens of millions of Americans. Their goal is to build a universal healthcare that reduces prescription drug prices, premiums, and out-of-pocket costs. The Biden administration has seen that after the Trump term, their healthcare goals were weakened, and their scientific research plans slowed down, damaging America's chance to an equitable healthcare for all. So, what is the political future of the Affordable Care Act? Under the Biden administration, and due to the pandemic, the American Rescue Plan prevented millions of people from financial hardship and allowed them to enroll in the ACA, breaking the record of the number of enrollees. Senator Susan Collins said the Affordable Care Act is now embedded in our healthcare system. The ACA is here to stay, but where Biden wants to increase subsidies to lower premium costs, Republicans want to change the ACA law at the core, lowering premium even more but for lower value in order to let a more capitalist insurance agenda settle. Underfunding. Public health could help planning community health in participating hospitals. As such, according to the American Medical Association Ethics Department, the ACA federal and state community benefit policy is ineffective for hospitals to address social determinants of health, even though 80% of them receive a tax exemption through the ACA. Most of them spend their exemption on unreimbursed care instead of community health needs. Therefore, it's necessary that state legislatures establish accountability and regulations to provide the needed care. Based on a TFAH analysis, all spending for public health by states has been declining, and state public health spending was actually lower in 2016 and 17 than it was in 2008 and 2009. A great example of the inequities and disparities we can see even with the ACA is through the COVID-19 pandemic. Indeed, state and federal funding contributed to help with the fight against the virus, but this was simply not enough and maybe a bit too late. As such, state and local governments' public health departments would need almost an 80% increase in the size of their workforce to be able to provide comprehensive services to their communities and have been consistently underfunded. Under 5% of the $4 trillion spent in 2020 was spent on prevention and public health. It's a chronic underfunding of American public health and a contributing factor to the pandemic. Another challenge, social inequities. Latinos are less likely to apply to the ACA compared to other ethnic or racial groups, and they're less likely to receive assistance as well. Also in 2016, African American, Latino, Asian, and American Indian adults were twice as likely as white to report difficulty obtaining a timely medical appointment for illness or injury. African American and other ethnic minority patients still suffer from structural racism. Studies show that physician communication behaviors may have a varying effect on patient trust, depending on patient race communication with physicians, including greater physician verbal dominance, less patient-centeredness, and shorter visits compared with white patients. A higher education also is the stronger predictor of ACA awareness. Therefore, targeted outreach efforts are essential to prevent racial or ethnic inequities in the enrollment of the ACA, assuring access to enrollment aid. Overall, the Medicaid extension allowed to eliminate 44% of the coverage gap across income group and reduce coverage disparities by 26.7%, reducing income disparities. Finally, trust. How does this affect the delivery of public health services? We have seen that a large number of our population simply does not trust our public health system enough, especially as the vaccination rate did not go as high as planned for COVID-19. Building trust should be a priority through localizing an education and modeling system that prefigures sincerity. Isaiah 12:2 said, God is indeed my salvation, and I will trust and won't be afraid. As we learn from our academic journey, we also need to learn from a Christian faith standpoint. And believing in God is simply not enough. This is when faith takes meaning. Faith implies trust. And in any life situation, we can have the choice of simply believing what we're told or have trust and take that leap of faith, take the risk. When trusting God, we need not fear as we take that risk and give Him our trust, our faith. When our population loses trust in public health, it is necessary to have a modeling example to refer to, just as we refer to Jesus as Christians. Our planning needs to be relatable and focus on the minorities and disparities as a priority in order to encourage trust. Now let's look at French healthcare. The World Health Organization ranked France's healthcare system at the highest. The French healthcare system is funded primarily by payroll taxes paid by employers and employees, a national income tax, and other taxes from certain industries and products. 95% of citizens have supplemental insurance as well to help with any dental or vision out-of-pocket costs. Prevention and curative care are covered, extending statutory health insurance to all employees, retirees, the self-employed, and the unemployed. For example, prices for a regular doctor's visit is about $30 without paying any premium, since it is part of a universal health care. These visits can be reimbursed at about 70 to 100% with a monthly mutuelle, which would cost about $60 per month. The healthcare system in France is mandatory. The government delegates and allocates budget to regional agencies responsible for planning and delivery of services. Patients pay co-payments and co-insurances, but 95% of them have a supplemental insurance to cover these fees. So there's also a cap of about $63 per year for physician visits, for example. So as we conclude, we can say that Jesus performed many miracles while he was on this earth. But he still believed that the sick needed to be cared for. In Matthew 9:12, he says, "It is not the healthy who need a doctor, but the sick." And Obama said that change does not typically come from the top down. It always comes from the bottom up. It's about watching each other's back and realizing that by caring for one another, we will make our country stronger. Thank you.